Hi, I'm Professor Jennifer Chips. I'm from the University of the Western Cape, the Faculty of Community Health Sciences, and I am the recently appointed Chair of Digital Health, part of the NRF DSI launch of chairs.
Can you please tell us about your academic journey and what inspired your research focus?
I've got a bit of a convoluted journey in that I have not been in academia that long. I've actually only been in academia for about the last 15 years. I did my master's in public health and then wanted to work in the Department of Health. So I actually did a 3-year internship overseas in the Department of Health, which was a very exciting experience, which I think shaped my view on how I view research, because when you work in the Department of Health, you are able to analyze a problem, develop the policy, and implement and evaluate it. And so I spent 15 years working in the Department of Health, implementing policy and evaluating it. And then I came to academia. And in academia, I was very interested, and I've always been interested in technology, and I'm a bit of a digital nerd. So one of the things that I was interested in was the use of telemedicine for psychiatric assessments. My clinical background is mental health, so I did my PhD in telepsychiatry, in developing a framework and a model to look to see how we can provide outreach to patients in rural communities by chatting to the psychiatrist via video conferencing. Now, interestingly enough, that was before COVID, and so there were a lot of challenges in the uptake, but obviously since COVID, the uptake of telemedicine, video conferencing has vastly increased. And along with all of COVID, what has changed is that there's been a substantial increase in technology, and it has actually quite exploded, and lately with AI as well. And so after my PhD, my interests remain in digital health and how we can actually utilize digital health to improve access for patients. So I did some work with around mHealth and using your mobile phone with SMSs or WhatsApp to send messages in terms of health. And then obviously now with artificial intelligence, a lot of our work is now focusing on AI-based technologies and how we can integrate that into health systems.
Can you give us an example on how your work benefits community, policymakers, or industry?
You know, one of the unique things about digital health is that it is a discipline that is actually transdisciplinary. It crosses from health to psychology, looking at behavior change, and then computer science. So one of the things that that's very, very important for us is to have a transdisciplinary focus, which is very new and unique about it. So one of the things that what we are doing for the community is that we are looking to see if we can use digital health to improve access. So one of the key things we're looking at is if you're looking at under-resourced areas such as primary care that have not got health information systems in place, we're looking to see if we can develop not off-the-shelf expensive apps from overseas, but can we develop locally developed, culturally relevant, contextual applications in local languages that we can, and also adapt it to the resources. So for example, we're looking at models of bandwidth, and so that it can be offered in rural communities where community can actually have access to services. So they can get access to health information that is accurate, and that we can implement open source systems within the health information systems so that we can monitor and look after their health. In terms of policy, we're doing quite a lot of work around the AI guidance for ethical use of AI. One of my PhD students is developing the nursing strategy for digital health in South Africa. And one of my other students have developed nursing competencies for health informatics, which we are now, together with the South African Health Informatics Association, we've created the South African Nursing Informatics and Digital and AI Committee, which she is going to work with to look at the implementation of these competencies. When I started in the beginning, I was saying this is an area that also needs to include the industry, because a lot of the technical development is currently happening in private and in technical companies as well. So we are at the moment collaborating with a non-profit organization to develop information systems, and we're using blended finance models. We combined with them to ensure that we have products that are appropriate for South Africa. So we're developing, for example, just a clinical placement system that will enable health professionals to manage their clinical placements in their facilities. It's being developed by the company, but will be implemented available to us.
What legacy do you hope your chair will leave behind?
I think for me, there's probably 6 things. I hope I'm going to remember them all. First of all, I think one of the things for our chair is that it is a chair that, though it is digital health and technology, that it's based in health. And so we have a very strong, equitable, person-centered focus on digital health and a community engagement focus around digital health. So I think the first thing for me is maybe our vision around digital health. Secondly, we currently have a workforce that is not as digitally literate as our young people that are coming through. So I think one of the key things is going to be to make the workforce what they call future ready. We have to train existing health workers in the hospitals, as well as integrate into our curricula digital readiness and AI, understanding of what AI entails and what it will mean for a health system. I think the other legacy as well is that we are developing new models of working together with other sectors, such as industry, but also with computer science, having not multidisciplinary, but transdisciplinary focus, producing new knowledge, working together in different fields. And another area which I hope we can address is that currently in Africa and South Africa, there's great data inequity, and that a lot of the algorithms for prediction that is being developed is based on Western data from overseas, and there's a great shortage of African data to inform our algorithms and our prediction work. So we're hoping that through the implementation of open medical record systems that we would be able to build on and address this data inequity. And then lastly, I think what we are aiming to do is to establish a center for equitable digital and AI research. So even once my chair position is finished, we hope that the center will continue to provide innovative work and to train the workforce to improve the health of the people of South Africa.